AED 3100 is a Japanese-made AED using Nihon Kohden technology. Remove the AED from the storage case. Place the AED close to the patient's head. Pull the power switch towards you.
Adult mode.
The lid opens, the power turns on, and the voice instruction starts.
Remove all clothing from
Operate the AED according to the voice instruction. Do chest compressions at a rate of about 100 to 120 times per minute.
Remove pads from blue liner and apply to
Remove
right upper
clothing
chest
from the
and
chest.
left side
If
as
clothing is
shown.
difficult to remove, cut through clothing with scissors.
Remove
Open the
pads from blue
package and
liner
take out the
apply to
pads.
Right upper chest and left side as shown. Remove pads from blue liner and apply to right upper chest and left side as shown. Remove pads from blue liner and apply to right upper chest and left side as shown.
When the two pads are attached, the pads placement indicator stops blinking.
Do not touch patient.
Stop CPR and move away from the
Do
patient.
not touch patient. Do not touch patient. Shock advised.
After confirming that no one is touching the patient, press the flashing shock button.
Shock delivered. It is safe to touch patient. Start CPR.
Resume CPR according to the voice instruction. About 2 minutes after starting chest compressions, the following voice instruction is heard.
5 more times. Do not touch patient.
Follow the voice instruction and move away from the patient. The AED restarts analyzing the heart rhythm.
No shock advised. It is safe to touch patient. Start CPR.
If electrical shock is not necessary, a voice instruction instructs you to immediately start CPR. Continue CPR according to the voice instruction until EMS arrives. Even if the person regains consciousness and becomes able to move, his or her condition may change, so leave the pads in place and leave the AED power turned on until EMS arrives.